Hello everyone. In this video, I will be discussing about an approach to abdominal pain. Very common case that you get in your medicine as well as in your surgery is a GIT case. Yes, it may be either in general medicine or in general surgery, you will be getting GIT cases. So it is very important to know what are the possible causes of an abdominal pain, because abdominal pain is a very common symptom that the patient says in all the GI cases, almost all the GI cases. So it is very essential to differentiate the various etiologies that causes the abdominal pain, the elementary causes as well as the non-elementary causes. In this video, I will be discussing about what are the elementary causes. Second, what are the non-elementary causes? How to differentiate between the various elementary causes of abdominal pain. The first and common cause of abdominal pain, a patient will always tell you, is because of the underlying peptic ulcer disease. The other cases which are more of surgical importance are biliary colic, acute pancreatitis, which is almost like an emergency, then renal colic. So in peptic ulcer, remember, the patient will complain of a characteristic epigastrial pain, which is gradual in onset, gnawing in character, and the patient usually says that, sir, there is radiation into the back. But remember, whenever there is radiation into the back, it is more classical towards acute pancreatitis. In peptic ulcer, the patient may not always say that there is a pain radiating towards the back, and there will be non-specific symptoms associated. And these abdominal pain because of the peptic ulcer will be exacerbated, okay, especially during the night or hungry, and it usually lasts for 30 minutes to 1 hour. You know, when we say peptic ulcer disease, it is either because of gastric ulcer or duodenal ulcer. Yes, fine. For example, the patient may say that, sir, I haven't been taking food properly for the last few weeks. I already have a peptic ulcer disease. Now it is got aggravated. So this is a characteristic example for peptic ulcer pain, abdominal pain. And what are the exacerbating factors? Of course, non-steroidal anti-inflammatory drugs. That is one of the most recent trending cause for peptic ulcer disease. Patient will be taking damn high amount of over-the-counter OTC, over-the-counter NSAIDs, okay, non-steroidal anti-inflammatory drugs. And it will be usually relieved by food following an episode of vomiting or taking antacids. And it is usually mild to moderate. Most of the time, the patient will be telling that, okay, the pain is bearable, unless and until there is perforation. Following that, the patient has peritonitis and all, it will be a severe unbearable pain. Coming to a biliary colic, it will be usually the pain will be confined to the epigastrium or as well as in the right hypochondrial pain, which will be rapidly increasing. But the character of the pain will be constant. The same intensity of the pain the patient will be experiencing throughout. Okay, and the radiation will be below the right scapula. And remember, the exacerbating factors are usually unable to eat fatty foods. Okay, because of taking more fatty foods, the patient will be having exacerbation, and the duration, of course, can last up to one day, and the timing and everything, it has not that much relevance in biliary colic. Okay, because only the fatty food which exacerbate the biliary colic mainly, and of course, it is a severe pain. It is an unbearable pain. That is why patient immediately presents to the emergency. Coming to acute pancreatitis, acute, it is one of the differential diagnoses for an acute abdomen. It is an emergency. Immediately we have to grade the patient as per based on the severity, okay, of acute pancreatitis. We have to first initially do the conservative management, and then only once the patient results, then only we will think about what are the possible etiologies. We will do further evaluation. The most common etiology for acute pancreatitis is number one, alcohol. Okay, then another one is gallstones. Fine. So either again it is an epigastrium to left hypochondrium. You know, towards the left hypochondrium only the tail of the pancreas is there. Yes, and of course the characteristic pain is there will be a radiation to the back. This is sudden onset pain, sir. Suddenly following a binge of alcohol intake, I experience this pain with severity is like the patient will not be able to tolerate this, and there will be extreme radiation into the back. Okay, the patient will be seeing that at the center of the two scapula. Okay, like towards the vertebral column, the patient will be experiencing severe pain in the midline. Okay, attacks can be enumerated after heavy drinking. Okay, and the most important aggravating factor is alcohol. Remember, sitting upright will relieve the pain of acute pancreatitis. And then coming into renal colic, again it is rapidly increasing. The patient will complain of pain which is radiated. That is the so-called as what pain? Loin to groin pain. Loin to groin pain is a classical of renal colic. It can last up to 24 hours. It is usually exacerbated following a period of dehydration. Sir, for the last 1 week, I was a bit busy with my work, so I was not able to drink water properly. Now I got this pain. Renal colic is an unbearable pain. It's a severe pain. Okay, immediately we will do NSAIDs and control the pain, and we will evaluate the cause, and we will first initially go for the medical management. If not, we will go for the surgical management, which is retrieval of the removal of stones. Okay, yeah, so that is renal colic pain, which is rapidly increasing in nature. Then coming into non-elementary causes of abdominal pain. Yes, this is the point where the examiner usually asks you, because you will be telling all the causes of the elementary causes of the abdominal pain, but the non-elementary causes, because there are lots of conditions, okay, which will misguide you. Okay, for example, myocardial infarction. This is a very, very common disease that the patient will present with an epigastrial pain without any tenderness. Okay, usually associated with hypotension or cardiac arrhythmias. Myocardial infarction almost mimic like, and I remember one of our senior gastroenterologists working in our hospital. He had an episode of epigastric pain in the midnight, and he's a gastroenterologist, and he told his wife that no, I'm okay, it's just a GERD, gastroesophageal reflux disease, I will be alright. And the next morning he was dead, because most of the myocardial infarction in this generation, okay, it occurs in the form of an epigastric pain without tenderness. So that is why whenever you get an epigastric pain, and don't expect that always the MI pain will be radiating towards the left, to the upper arm, towards the jaw. No. Immediately you have to go to a nearby hospital, and you have to make sure that you are getting an ECG done. Then dissecting aneurysm, which is a very, very tearing interscapular pain associated with the hypotension. Acute vertebral collapse, again the patient will be having the patient will not be able to do any movement, okay, and there will be extreme tenderness over the involved vertebra. Then cord compression, there will be pain on percussion of the thoracic spine, and there will be hyperesthesia of the affected dermatome. Okay, the affected dermatome, for example, if the T5 dermatome is involved, at the T5 dermatome there will be hyperesthesia, and below T5, all the dermatomes, there will be complete sensory loss. Then herpes zoster, again there will be vesicular eruption. Diabetic ketoacidosis, one of the most important symptom of diabetic ketoacidosis is abdominal pain. It has been asked as a previous AIMS PG entrance exam question. Diabetic ketoacidosis, the patient will comes with abdominal pain, air hanging, okay, ketotic breath, tachycardia and everything. And of course, tubal pregnancy, mainly suprapubic, okay, suprapubic pain associated with nausea, vomiting, fever, again torsion of testis or ovary, because all these are lower abdominal pain, especially female of reproductive age group coming with the lower abdominal pain with the localized tenderness, nausea, vomiting. We always, first thing we do is UPT, that is urine pregnancy test, and we will rule out pregnancy, because it may be a ectopic pregnancy, and or it may be like a torsion ovary or a torsion testis. All these have a lower abdominal pain associated with fever, localized tenderness, nausea and vomiting. So whenever the word abdominal pain, when the patient is telling, you must keep all these things in mind. It's not just only the abdominal causes, it's also because of a lot of non-elementary causes, and that is why this abdominal pain is a symptom which is the most interest topic of discussion by examiners in clinical exam. Thank you.